These are people who know business and they know all about good health. Wayne Kaler-Thompson, I'll start with you, Wayne, if I may. Wayne is the head of VECI, which is a huge organisation in this country that looks after employers and employees. Wayne, are the employers taking it seriously about good health in the workplace, and are they doing anything about it? And if they are, what are some of the outcomes that you've noticed?
Thanks, David. Look, I think smart employers certainly are. They recognise the direct connection between healthy employees and productivity and results. But there are other imperatives as well that are driving others to always to some degree be forced into this situation. In this country we have significant skill shortages. They haven't gone away despite the economic downturn, they're coming back. They recognise that we've got an ageing population and therefore the scarcity of labour in the future. We recently conducted, as part of our public policy advocacy, a report into workplace futures, looking through to 2025, and identified that we've got a serious labour shortage in this country. As population age increases, the impact then of chronic disease also has an impact on that, and therefore the simple laws of supply and demand, as employers are struggling to attract and retain the workforce that they have, means that they get drawn into directing it. But the smart employers, as I mentioned, recognise the connection, recognise the benefits on productivity, on the ability to retain staff, the ability to provide a different workplace than what they would have been providing in the past, and they are driving a lot of the direction about expectations, if you like, of employees wanting to be attracted to good employers.
And are the employers actively seeking out advice from VECI? Is it now the right thing to do?
Yeah, yes, absolutely. I mean, as a result of some of the programs that we've been involved with and promoting, around identifying that there is a direct connection as well between the fact that we've got an enormous amount of accrued leave on the balance sheets of companies, the fact that we've got just an enormous number of people who aren't taking their annual leave means that that's a liability on balance sheets, but it also is having an impact on productivity as well. So people are seeking advice about how to deal with that, and there's a national program called No Leave, Low Life to encourage employers, and we're actively involved in recognising that nationally to encourage employers to act on it. But part of that is actually not just taking leave, but to take leave within your own country, within your own region, within your own state, and therefore there's a direct connection to what we're talking about here in healthy parks to get people out and active as part of that. There's a lot of now better research, and we've heard a lot of research through this Congress that's reinforcing the fact of the direct connection between activity, exercise, whether that's in the workplace or whether that's taking leave, and the impact that that has on productivity. So we're finding that good employers again are focusing on providing more activity in the workplace. We recently involved ourselves in a study on sedentary behaviour that I was interested to hear William talking about, and it gives you a shock to realise just how little activity is actually occurring now in the workplace. Victoria's economy has moved more and more towards a service-based economy, less manufacturing, less of those sort of active stages of employment, and therefore we've got people who are not moving. So good employers again are active in involving activity in their employees and seeing the direct benefits of that on productivity, the ability to retain staff, the ability to actually influence a broader agenda than just while people are at work.
Dr Frumkin, you're an environmental health expert. Are the workplace ambassadors, the employers, taking that seriously, and how do you explain it when you say environmental health?
Environmental health has meaning in the larger community, but of interest to this audience, it also has a meaning within the workplace. We all know the desirability of that corner office. That's the office to aspire to. But there's a reason for that. It probably has to do with the ability to be exposed to natural daylighting. People like natural daylighting. And that's just one example of how the natural environment, when brought into interior spaces, can be very beneficial. We have very solid evidence that people feel better and performance is better with natural daylighting. Not quite so strong evidence, but some evidence that having plants in offices makes people feel better and perform better. And having views of nature out the window makes people feel better and perform better. So this notion that William referred to of an evolutionary history embedded in nature gives rise to a theory called biophilia, that we have a natural connectedness with nature. And that leads to something recently developed called biophilic design, where through architecture and through interior design we can bring bits of nature into the office That's a piece of environmental health. It's a set of data points that show us that the contact with nature in office spaces is beneficial for people. And by the way, we have very similar data for children in schools who perform better and feel better when exposed to nature, and for patients in healthcare settings.
Okay, let's extend that, because I've just moved into a new workplace where one of the rulings was no plants. And that lasted about one day with me. I said, come into my office and there is a plant on my desk, because I actually like having it there. You've talked about the natural light, with obviously the sun coming in, the plants. What are a few other simple tips that people could do to make it a more friendly place, better for your health?
Well, this is one of these places where the green building agenda dovetails with green health. If we think about green buildings, which we need to think about in terms of energy conservation and natural resource conservation, that's a certain agenda on the environmental side. If we think about healthy places, that's an agenda on the health side. And the sweet spot is where the two intersect. So using sustainably produced materials to build buildings, using cleaning materials that don't off-gas solvents that may be harmful to people's health, providing that natural daylighting, providing good climate control with access to fresh air rather than closed indoor spaces. All of these are principles that are both environmentally sound and good for the health and well-being of people in the buildings.
With our other guest speaker, Stan Mazionis, who is Chief Executive Officer of Medibank Health Solutions. First of all, Stan, just explain the Medibank Health Solutions side of the business.
So George talked earlier today about Medibank moving from being beyond a health payer to a health player. So we have around 1,000 medical health professionals around the country, and we're providing a raft of services to our members, but also to employers and to the public at large, ranging from health and wellbeing programs, medical and functional assessments, right through to injury treatment for our injuries in the workplace, and indeed to the public at large.
And you've done a lot of research to back up what you're doing in the marketplace. We've heard the word obesity so many times in this conference that you're right on top of that, aren't you?
So when we provide our programs to our members, we do take some care to see that these are evidence-based, that there is in fact a return for the dollar. We've been running a program for our members which we call Better Health on Call for some 5 years, and we did some epidemiological studies against randomised control groups, and in fact what we found is that we had something like a 5% reduction in hospital admissions, and we had a 5% reduction in costs to our health insurance fund from people who are involved in these programs. Now that translates exactly to the workplace. The same investment or similar investments by an employer will translate to higher productivity. And people who are already moving into chronic disease, who we're doing more than just coaching, lifestyle coaching to prevent them. We are seeing an increase in compliance with caring for themselves. For example, people with diabetes complying with requirements for checking their feet and eyes, etc. So we've measured a lot of benefits from these programs.
Stan, what do you think is your greatest challenge with your team? And congratulations on what you're doing for the future. What is the challenge that you're saying to the staff right now? We'd really like to tackle this.
I think we've got an ageing workforce in Australia. I look around the room, there are lots of young people. I also see a lot of people here who watched Armstrong first walk on the moon and were already adults at the time. And we need to have these people in the workforce. We need these people, us, in the workforce. We need to stay healthy. We owe it to ourselves and our community. We're going to have double the number of people aged 65 in Australia in 25 years, triple the number of people aged 85 and over. Chronic disease is associated with ageing, and what the challenge is to put in place the preventative programs, and there are individual responsibilities, but employers certainly have the opportunity to contribute to that, to put in place programs to keep people healthier longer. We did a study recently, I think a very aptly named report, Sick at Work, just the impacts of presenteeism, as it's called, as opposed to absenteeism. Now the figures show that something like 4 times the impact on productivity of presenteeism compared to absenteeism. If you average it out over the workforce, 6 days per worker per year in Australia, and that's from the usual suspects. It's from the allergies and asthma, it's the hypertension and the heart disease, the diabetes and the depression. So there are these raft of interventions, preventative interventions that we can put into place, and we need to have that growing awareness that these are available. They're simple, they involve exercise, they involve the environment, and there's still, to be fair, I think a growing need of an awareness that the interventions are there and that they're cost effective to put into place.